Millions of kids are about to lose their health care, and the people who voted for it don't even realize it yet. Medicaid is getting gutted, hospitals are closing, and somehow we're funding wars instead of keeping people alive. Welcome back to Mind Mirror. Let's get into it.
I represent 67,000 pediatricians across the country who are going to bed and not sleeping because we are worried about the children that we are privileged to serve in every community across the country. We wake up every morning trying to figure out how we can support children. Let's be perfectly clear. This bill, it will cause devastating impacts to children. And while children only represent 22% of our population, they represent 100% of the future, and they will bear the brunt of most of the legislation in this bill. They will lose food through SNAP, and importantly, the entire pediatric healthcare delivery infrastructure is threatened with the cuts to Medicaid. And let me connect the dots for everyone in the audience. When we think about Medicaid, 50% of children in this country, yes, half of our children in every community, and it's more than half in some states, depend on Medicaid as their healthcare insurance.
Let that number sink in for a second. Half of the children in this country rely on Medicaid. That's not some niche program for people who aren't trying hard enough. That's the backbone of pediatric healthcare in America. And the woman saying this represents 67,000 pediatricians who can't sleep at night. These are doctors who devoted their lives to keeping kids healthy, and they're watching the floor get ripped out from under them in real time. So before anybody hits the comments with, well, parents should provide, understand that for millions of families, Medicaid is how they provide.
Insurance. This is healthcare insurance and coverage for half of the nation's children.
Oh, MAGA, you're in trouble. Apparently there's a shortage of workers on the farm. But don't worry, MAGA. Brooke Collins, who heads agriculture, says that she has a solution. Seems like Trump and Brooke Collins have put their heads together and come up with a solution to solve the problem on the farms losing workers. Let's watch the video and see what Brooke Collins has to say to solve this issue.
Score enough. There will be no amnesty. The mass deportations continue, but in a strategic way, and we move the workforce towards automation and 100% American participation, which again, with 34 million people, able-bodied adults on Medicaid, we should be able to do that fairly quickly. Thank you.
Did you hear that, MAGA? They're saying if you're able-bodied and on Medicaid, you are going to work in the fields. MAGA, this is where it hits you. You're going to work in the fields.
The irony here is so thick you could cut it with a knife. Deport all the farm workers, then tell your own supporters to go pick crops. That's literally what's happening right now, able-bodied and unmedicated. Congratulations, you just qualified for field duty. The same jobs that were supposedly beneath Americans 6 months ago are now your patriotic responsibility. You can't make this stuff up, honestly.
Fields. And you're going to see.
The anti-American Republican Congress has just announced today to give Trump and Hegseth what they want, the $200 billion to continue to fund their Iran war that nobody wants. They're thinking of making more cuts to Medicare and Medicaid. They want to hurt more Americans so that they can fund hurting Iranian civilians. So.
Did you know that people who look just like me can have kids with complex medical needs and disabilities? Yeah, there's a lot of parents out there who are really worried because of the Medicaid cuts. And if President Trump is saying that this big, beautiful bill, which is a big, dangerous, god-awful, will cause childhood deaths bill, is not cutting Medicaid, that's an absolute bold-faced lie. And he's cutting Medicaid $880 billion, and it's going to be devastating for children with complex medical needs and disabilities. And there's children all over this country, in your state, in your community. So if you voted for this, and if you're sitting by and rationalizing and thinking that you're just going to go ahead and live in your la-la land and believe in Trump's lies that he's not cutting Medicaid and this bill isn't cutting Medicaid, you are absolutely deluded. It is going to be absolutely devastating for children. Listen, you say parents, one of the arguments I've seen on this app, which is...
What she's saying here cuts deep, and I need everybody to really hear it. She lives in a privileged household. Both parents are physicians. They have private insurance. She didn't have to come on here and fight for this, but she understands something fundamental that a lot of people miss. You don't control your children's health. You can do everything right, have 2 incomes, eat clean, exercise, and your child can still be born with a condition that requires round-the-clock care, that requires specialists and equipment and therapies that cost more than most people's mortgages. And when she says parents would trade places with their kids in a heartbeat, that's not hypothetical. She sees it every single day in her practice. So the next time someone says those parents should just work harder, ask them how hard they'd work with a $50,000 annual medical bill on top of everything else.
Absolutely absurd is that parents need to take care of their own children. Well, guess what? I live in I have a privileged family. My husband and I are both physicians. We have healthy kids. We have private health insurance through our employers, okay? Not everyone is so lucky, and that isn't the case for a lot of parents who, that is part of providing for their children, is maybe that they need Medicaid to provide those healthcare services. That's what we're here for, is to help all children. And it's not as simple as understanding that, listen, in America, it's messed up how our healthcare system is. It's all employer-based healthcare. And that doesn't work for everybody all the time throughout the child's life. And so, especially when children have complex medical needs and disabilities, they have a lot of needs and services, and it's not their parents' fault. And we don't control our children's health, because those parents would be the first ones to take their kids' place. So everybody wake up, give your representatives a call, and advocate for them to stop and to not pass this big, beautiful bill, which is the big, dangerous, god-awful, will cause child death bill.
No one has talked about cutting one benefit in Medicaid to anyone who's duly owed. What we've talked about is returning work requirements. So, for example, you don't have able-bodied young men on a program that's designed for single mothers and the elderly and disabled. They're draining resources from people who are actually do that. So if you clean that up and shore it up, you save a lot of money and you return the dignity of work to young men who need to be out working instead of playing video games all day. We have a lot of fraud, waste, and abuse in Medicaid. Just one tiny example. The estimate is $51 billion a year in Medicaid is lost to fraud.
Classic misdirection, and I gotta break down why. He says we're just adding work requirements, not cutting benefits. But who is actually on Medicaid? Children, elderly people, disabled Americans, none of those groups can go get a 9-to-5. So the work requirement isn't really about getting people working. It's a bureaucratic wall designed to kick people off the program, and that $51 billion fraud number he dropped. Even if that's accurate, you don't demolish the entire house because one pipe is leaking. You fix the pipe.
That's unconscionable. We now have, with the DOGE efforts and with new algorithms and with new oversight responsibilities and opportunities, we have ability to carve that out. We have a responsibility to do it. That estimate by some people, some estimates say that is very low. It's actually much higher than that. So we're going to go through.
So Democrats are lying again. That's why we call them fake news for a reason. And this time it's regarding Trump cutting Medicaid. Didn't happen. Republicans are actually increasing Medicaid funding by 24%, contrary to all the lies. This is a great approach because it's a responsible growth. When you have a program that 85 million Americans rely on, that is a very safe, respectable way to go about it. Democrats love to act like everything Trump does is to benefit him and his rich friends, which is not true. You know who this is benefiting? Working class families with children, people with disabilities, elderly people. So ask any Democrat you know to explain the 24% increase. They won't, because they're lying and it doesn't fit their narrative. Democrats make this seem like Republicans are taking away people's health care when really they're taking their money, investing it more wisely, so more people have the opportunity to get these benefits as well. So
this talking point about a 24% increase is maybe the most dangerous lie floating around right now. And I say dangerous because it sounds true if you don't think about it for more than 5 seconds. Here's the reality. Healthcare costs are projected to grow way beyond 24% over the next decade. So if you increase funding by less than what costs are rising, that's not an increase that's a slow bleed. It's like telling someone drowning in 6 feet of water that you raise the floor by 2 feet. They're still underwater. Hospitals don't run on percentages, they run on actual dollars. And when the dollars don't match the need, the doors close. Period.
we're right again.
So we have a group of white Afrikaners now living in America that were brought here on refugee status. But they're getting free housing, food, healthcare. They're getting taken care of by the government. But yet we have veterans that are sleeping on the streets, homeless. We have brown people being trafficked to foreign countries. Like, I don't get it. Like, why are we bringing white racists here? You know, and making them settle in Idaho, North Carolina, and Ohio. I mean, I guess that's where racists live, but like, why are we bringing people here when I thought that this whole administration was against immigration and they were going to do mass deportations? And, you know, so far I guess they're just against brown people? Interesting. And then I thought we didn't have money to take care of veterans or poor people who already lived here. So why are we bringing in poor people who need government assistance and taking care of them and giving them housing and food and health care and all of the things that we can't do for our citizens? When also our cost of living is about to skyrocket because of this new Medicaid cuts that are going to go if the budget goes through. Like, it doesn't even make sense.
The contradictions here are absolutely staggering when you lay them all out. Can't afford Medicaid for American citizens, but can afford to resettle refugees with full housing, food, and health care. Can't afford to house veterans, but can afford $200 billion for a war nobody asked for. The "we're broke" argument only applies when it's regular people who need help. The money magically appears when it's for something else entirely, and the people getting hurt the most are in the same communities that were promised they'd be taken care of first.
Like, the whole thing is like, it doesn't make sense. It just doesn't make sense. This is ridiculous.
In fiscal year 2024, Medicaid costs for emergency services for illegal immigrants skyrocketed by 142%.
Just so I'm clear, we're supposed to be angry about humans receiving emergency medical services? That's what you're saying? Because, again, so we're clear, undocumented people do not have access to Medicaid or Medicare, okay? And that is also a separate topic. But you specifically brought up emergency services, meaning you're angry that people in an emergency situation, you're angry that they're getting emergency medical care? And you think that we should also be worried about that? Because as somebody who has worked in an emergency room and works in a hospital, never fucking once have I ever seen somebody in need and thought, I wonder if they're documented. Never, ever once has that crossed my mind. One time, this poor man who was working for a tree trimming service, something went wrong, tree branch in his eye socket. Rolls into the ER, tree branch in his eye socket. Never fucking once did it cross my mind to be like, oh, is this man documented? No! I'm like, oh my God, this poor person. Let's give them the emergency services that they very clearly need. People come in all the time who don't speak English and they're in diabetic ketoacidosis or septic from a severe cellulitis or something. Never fucking once has it crossed my mind whether or not they're documented, because I don't give a shit. And we shouldn't give a shit. When I see somebody in need, I want to help them. Hence why I entered into the medical field.
A tree branch in his eye socket. And somebody out there thinks the first question should be about documentation status. I want everyone to sit with how sick that mindset is. This woman has worked in emergency rooms. She's seen people at their absolute worst, bleeding out, septic, in diabetic crisis, and never once did she think about where they were born, because that's what a decent human being does. But here's what really got me. She flipped it perfectly. Who's paying for gold foil walls and alligator Alcatraz and militarizing American cities? Y'all are real quiet about those expenses. But someone getting emergency surgery to save their life, that's where fiscal responsibility kicks in. The selective outrage tells you everything you need to know about what this is really about.
And oh, who's gonna pay for those services? I don't want to pay. Fuck you. Disrespectfully, who's paying for the $200 million ballroom in the White House? Who's paying for the tacky gold foil on the walls? Who's paying for alligator Alcatraz? Who's paying to deploy National Guards onto American citizens? Who's paying for the occupation of American cities? You haven't thought about that? You haven't cared about that at all, right? You don't care where that funding comes from, but you care when people in need are getting emergency medical care? I'm surprised you don't burst into flames with that cross on your neck, Caroline.
Republicans are now looking to cut healthcare funding in order to fund ICE and the Iran war. Yes, more war in the Middle East is their priority as opposed to making sure people can get care that they need. Top House Republicans are looking at healthcare offsets addressing fraud in federal programs, as they did during last year's debate over the budget law that made deep cuts to Medicaid spending. Republican Representative Jody Arrington is reviving an idea that was considered last year to fund Affordable Care Act payments known as cost-sharing reductions. However, this would lower ACA premiums by 11%, but also result in 300,000 more people being uninsured. These discussions are still in the early stages, but the driving force is the need to pay for the war in Iran and fund ICE, the latter of which triggered the partial government shutdown. And of course, Democrats oppose both, but Republicans are getting ready to use a party line process known as reconciliation to get around a Senate filibuster. So no healthcare funding, but funding for Iran is great. I mean, seriously, this is where the Republicans are. Getting healthcare, making sure you can get any medication or treatment that you need. Apparently that's too expensive, but war in the Middle East, well, that's right up their alley.
Medicaid is under attack by Republicans in the Congress, and this is very scary if you are applying for Social Security disability or supplemental security income benefits. Here's why. First, if these cuts go through, you might lose access to healthcare while you're waiting on your disability claim, and that can take months or even years. Without Medicaid, it's harder to afford doctor's visits, medications, or even the tests you need to prove that you're disabled. That makes it easier for the government to deny your claim. Second, mental health care is going to be on the chopping block. Many people applying for disability benefits have depression, anxiety, or serious mental illness. Without Medicaid, therapy and psychiatric care could disappear. That means more suffering and, again, fewer medical records to support your claim.
This is the part that genuinely scares me because it's a design trap. Think about this cycle for a second. You're disabled, you need to prove it. You need medical records. To get medical records, you need to see doctors. To see doctors, you need insurance. Your insurance was Medicaid and it just got cut. So now you can't prove you're disabled because you can't afford the appointments. And your claim gets denied because there's not enough documentation. It's a perfect closed loop of cruelty. And mental health is even worse because depression and anxiety don't show up on an X-ray. You need consistent therapy records and psychiatric evaluations. Take away Medicaid and those records stop. And so does your case.
Third, states could respond to the cuts by making it harder to qualify at all. We're talking more paperwork, more red tape, and tighter restrictions, especially for people with low incomes and complex needs. Fourth, the specialized care you might rely on, like physical therapy or speech therapy, even assistive tech like wheelchairs or communication devices, those services could be reduced or eliminated completely. And finally, with Medicaid gutted, more people will turn to overcrowded emergency rooms, free clinics, or nonprofits for help. But those places are already stretched thin with limited funding. So where will people go? The bottom line is that slashing Medicaid hurts the very people disability benefits are supposed to protect. If you're applying or even thinking about applying, this is your fight too. So tell me in the comments, how would losing Medicaid affect you or someone you care about? I want to hear your story.
I think it's incredibly important that we make, first of all, crystal clear that any Republican in Congress who voted for this bill cannot call themselves a moderate. This is the most heartless and devastating bill that we have seen go through Congress in decades, perhaps in a century. This is a tax giveaway to Donald Trump and his billionaire donors that they just partially pay for by raiding the health coverage of millions of Americans. Look, there are, as you mentioned, a lot of terrible things in this bill. But in addition to putting at risk the health coverage for 15 to 17 million Americans, 1 in 5 Americans rely on Medicaid for health coverage, and millions within that program are at risk of losing their coverage. In addition to that, this is overall the single greatest remake of the American healthcare system in a generation or more. This is Trump care. And Trump care means 15 to 17 million Americans more not having coverage. It means rural hospitals closing across this.
15 to 17 million people losing coverage, and the ones who get hit hardest are in rural communities. The same small towns where the hospital isn't just a hospital. It's the biggest employer. It's the economic engine. It's the thing keeping that town alive. When it closes, you don't just lose healthcare. You lose jobs. You lose property values. You lose the town. And then you're driving 2 hours to the nearest ER during a heart attack hoping you make it. Every single person who voted for this bill owns every consequence that follows. Every closed hospital, every denied claim, every family that goes bankrupt from medical debt. That's not a political opinion. That's just math.
Country. And when you decimate a critical leg of the healthcare stool, you are impacting all patients who will see higher premiums, who will see longer wait times. And Donald Trump and congressional Republicans, they own that. Every single time a patient loses.
What we just watched is a system being dismantled in real time. Kids losing coverage, disabled Americans losing their lifeline, rural hospitals shutting down, and somehow the money is always there for everything except keeping people alive. So here's my question for the comments. If these cuts hit your family tomorrow, what would you actually do? I want to hear real answers because this is a real problem. Like, share, subscribe.